This is Dr. Ishita Seth from Apollo Dental. For those who don't know me, I'm the dentist here at Apollo Dental. We are located in Valentine Corners in South Charlotte, and we are located on North Community House Road. So today I wanted to come in for a Tooth Talk Thursday session, and I am talking about today the periodontal disease. As during the COVID times, we are talking about building our immunity, and studies have shown the oral cavity or the oral health is very much connected to our overall health and body immunity. So I wanted to touch this topic as we get a lot of questions from our patients. But before I do that, if you could let me know what part of country are you watching from, as we are always interested to know about our viewers, whether you are watching it from Charlotte or Columbia or Missouri or somewhere else, please let us know. So what we would be covering today, I would be talking about what causes the gum disease or a periodontal disease. How can we correct it? What are the different signs or the symptoms for that? And what are the different treatment options for that? So, but before I do that, let's see what is the normal structure of our tooth. So this is our tooth, and this is holded by the tissues around there, which is the gum tissue, bone, and the fine fibers, which are the small periodontal ligaments. So this is a normal, healthy tooth. So what happens with time as we eat and chew, the plaque starts developing around the tooth, and this causes the inflammation around the gums. You can see that there is some tissue destruction around there, and you may notice some bleeding in there too, what we call it as gingivitis. And if the plaque stays in there for a longer time, then it changes to solidifies and changes into tartar. So at this condition, you will see more tissue destruction, more gum inflammation, and there you can see the bone loss around there too. And the hugging of the gums around the tooth has gone over here, and there is a pocket which is formed in between the tooth and the gums. So, and bacteria is sitting down there, which is causing all the destruction in there, what we call it as periodontitis. And further aggravating condition for this is in which a pus is formed around there, which causes even more destruction. So what causes or what makes you more prone for this gum disease? First of all, not taking good care of your teeth and gums. That involves your regular checkups and cleaning with your dentist or hygienist, along with that regular care at home, which includes twice a day brushing, flossing, and doing a mouth rinse. Other than that, there could be other conditions that makes you at more risk for this gum disease, which could be taking any kind of tobacco, whether you are smoking it or chewing it, as tobacco reduces the normal healing power of our teeth, and it increases the bacteria levels in our mouth. Other than that, if you are taking any kind of medications like blood pressure medication, or you are taking some steroids, they can also lead to gum inflammation, and they can also lead to bleeding in there. Also, if some pregnancy or maybe other oral contraceptive pills can make your gums enlarged, or if you have any autoimmune disease, or if you have some diabetes or HIV or hepatitis, or if studies have shown even like heart problems can make you more prone for this gum problem too, gum disease too. So if you have any of these medical conditions, please stay on top of your regular checkups and cleanings with your hygienist and or dentist. So what do you notice when you have the gum disease? You may notice nothing sometimes, or you may notice some bleeding from your teeth or gums on flossing or brushing. Other than that, you may notice some bad breath or bad odor even after cleaning your teeth. You may notice some loosening of the teeth. You may notice a change in a way, a partial denture or your teeth fit together. So if you have any of these conditions, please feel free to talk to your dentist or to your hygienist. And as you could see, your dentist can look at your bone levels from your radiographs too. As you can see over here, there is a normal periodontium and good bone level. But over here, around 70 to 80% of the bone has already reduced. And that kind of makes you even more prone for other oral conditions. So what are the treatment options for this? That includes a professional cleaning for gingivitis. And if you have periodontitis, your dentist or hygienist may recommend scaling or root planing, which is deep cleaning, in which we go deeper into the pockets to clean them. And then we polishes the tooth surface so that the ligaments get attached to the tooth again. Other than that, you may need what I recommend to my patients are the PerioProtect trays, which are the medication delivery trays in which they dispense the medications deeper into the pockets, which are otherwise hard to get cleaned with a toothbrush or a floss. So if you would like to know more about any of these treatment options, talk to your dentist or give us a call. Our number is 704-230-0502, or you can also send us an email. Our email is info @apollodentalnc.com. We would be happy to answer your questions. And that's all for our Tooth Talk Thursday. If you would like us to touch any particular topic or to talk about any particular thing, please feel free to type down in the comments section. We will discuss about that on our next Thursday. So till then, take care, stay healthy, and good night.